Hello. So it's 15:10 now, and I think we shall start the program. And my name is Prof. Edward, and I am the chairperson of the Singapore Nurses Association Education Committee. And this is our first webinar seminar for all our members. And the topic today is the new norms, how nurses cope with training and education during COVID. And we are very happy to invite four speakers today. We have a student, and then we have a director of nursing, and then we have a professor, and then we have a nurse educator from the hospitals. And we want to hear from each of them what are some of their challenges and some of their field or some of their innovation work that they do during this very tough time for ours. Even though we got a vaccine coming up, it's still we are still quite away from a lot of people again. So without further ado, I will invite Suvata. Okay, so the first speaker will be Suvata. Suvata will be talking on the conquering challenges and adapting to refined norms in learning. Uh, okay, and Suvata is a student. Okay, and she is also the chairperson of the nursing committee, right? So yeah, so in NUS, and so without further ado, I will hand over. Um, Before I hand over the mic to Suvata, I also need to introduce the rest of the speakers. I'm so sorry. No, so we have Suvata. Okay, Suvata, can you just move your hands? Hello, hi. And then we got Prof. Dora. Okay, from University of Glasgow, and we have Samantha. Okay, from the, Parkway, right? East. And then we got Jessica from Surana Home itself. And of course, we have one of our members, Sandy Teo, who is our committee member that I'm so glad she is here. Okay, so without further ado, okay, I hand over to Suvata. Suvata, over to you.
Thank you, Prof. Edward. So I'll share my screen now. I can see my screen. Okay. All right. Good afternoon, everyone. So I'm Suveta, the president of SNA-SC NUS. So I'm currently a first-year nursing student, and with the help of input from my seniors and friends, today I'll be sharing about our experience as a student nurse during this pandemic. So this will be my agenda for today. Firstly, I want to give a brief introduction to the type of modules and classes we have and how COVID redefines certain norms, followed by the pros and cons of studying during COVID, how we coped with it, the exam experience, as well as the clinical experience during this tiring time. Okay, so firstly, in NUS nursing, right, we have two groups of modules. One would be the core nursing modules, which are assigned to us each semester by the school. And the other one is the unrestricted elective module, where students choose something of their interest, which may or may not be related to nursing. And we need to clear two of these unrestricted modules over the course of 3 years of nursing studies. In all these modules, we usually have lectures, tutorials, and as for the nursing modules, we have lab sessions. And as we all know, lectures are usually held in lecture halls, tutorials in classrooms, and lab sessions in simulated wards. However, due to COVID, all of the venues changed. Lectures and tutorials were all shifted online, and the lab sessions were very limited as well due to the COVID restrictions. COVID also caused some changes in certain exam formats as well as clinical attachments, but I'll go more into detail when I discuss them later on. So now, with all the changes that occurred, I will move on to the pros and cons of studying during this pandemic. So firstly, the pros. As stated earlier, since most of the lessons are shifted online, there was barely any traveling to do, which was personally very great for me because I'm not a big fan of commuting. So yeah, without these traveling, online classes give us more interval between lessons to catch up on anything missed during the lesson, clarify any doubts we may have, or simply just take a break before the next lesson without having to go through the hassle of changing venues. I would also say that this also helped with having a more flexible schedule to work with as there's more free time. Since I am a year one, I was not able to see the transition from the physical lessons to online lessons since everything was already online when I went in. Thus, I asked some of my seniors about the transition, and they said that online classes were more convenient and accessible. For example, when they had to choose their unrestricted module, they had more options of classes to choose from since they did not have to factor time of traveling inside. So if the module they were interested in was only available back to back with another lesson they already have, they were still able to enroll in it without having to choose another date. Next, looking at the pros, I feel that COVID has made everyone think outside of the box, especially when it comes to thinking of ways to have meaningful and efficient discussions online. Especially for bonding events, it is very difficult to bond online. Thus, I felt that it was very fulfilling to see students coming up with unique games and utilizing existing platforms such as Among Us and Werewolf to break the ice. Furthermore, as for the learning side, I would definitely applaud the efforts of teachers who come up with different platforms to facilitate better discussions among students. And of course, last but not least, waking up later for morning online classes was definitely one of the pros. Now I'll be moving on to the cons. As discussed earlier, online classes are amazing as we get to do it from the comfort of our own homes. However, this also means that it's very, very easy to get distracted. With all the devices being right next to us and the teacher not being physically there, it is very easy to get distracted by the tiny notification that pops up. And if we have a pet at home, that is bonus distraction. Next, as I mentioned earlier, online classes do give us quite a bit of free time. So we are often under the impression that we have more time to catch up on later. Thus, during this pandemic, I feel that some students tend to have a more laid-back attitude towards learning. This could be a positive thing if the person handles it well, but it can also possibly turn into procrastination, which is not the best thing for learning. Next, one of the cons that really impacted the nursing students was that there was way lesser hands-on experiences. And as for the year ones, there was no anatomy labs for us to look at the cadavers and learn. The lab sessions were very limited as well. Due to COVID restriction, our tutorial group was split into smaller groups to attend lab sessions on different weeks. In this kind of situation where lessons are mostly online and even when we meet, it's not the whole class, it is rather very difficult to make friends and forge new bonds. This was one of the cons that the year ones dealt with, especially as even our orientation was online. Since we're all new to the school, it was very difficult for many students to get out of their comfort zones to make friends through online lessons. So now I'll be moving on to how we coped with all these changes. Firstly, I would like to thank the teachers and the school at this point as they have really put in a lot of effort to make the transition as smooth and efficient as possible. They came up with creative ways of teaching and made adjustment to lesson and exam plan, which really helped us students. From my point of view, I believe that we were able to cope well by being more proactive in our learning and having a positive attitude. For example, during the online lectures and lessons, I noticed that many students were very dedicated and proactive in clarifying their doubts and answering teachers' questions. Furthermore, instead of being negative about the changes brought in, most of the students looked at the positive sides of online lessons and made the most out of it. Secondly, we coped by minimizing distractions as much as possible. For example, choosing to keep other devices away and studying in a more conducive environment where distractions are as minimal as possible. Personally, I coped well during COVID by taking learning at my own pace. As stated earlier, by utilizing the free time we have, we're able to better cope with the workload while engaging in events organized by the school. And as for making friends, most of us made a conscious effort to bond and forge new bonds. For example, even though my tutorial group was split into smaller groups for lab session, we made it a point to have lunch in our smaller groups. Furthermore, due to group discussions and project works, we were able to forge bonds in our tutorial groups. Now I will go more into details about our exam experience. Usually, most of the nursing exams are held online using the platform ExamSoft. However, there are some exceptions. One example would be communication module where we learn to better interact with the patient and also interview them. Thus, we were assessed with the help of simulated patients. Another example would be the Fundamentals of Care module, where we have lab sessions for our nursing skills. Usually our nursing skills are assessed in the lab as we practice them. However, due to COVID restrictions, there were some changes that were made to the modes of assessment. For the communication module, we were not able to meet the simulated patients face to face, but rather online. Thus, factors such as physical touch or comfort or reassurance were revised from the assessment rubrics so that we are assessed fairly based on our best to the best of our capabilities. As for the nursing skills, since they could not be assessed in the labs, the exam was changed to a written assignment, which was not the best for me as I'm not a fan of writing essays as well. All of this was new to many of us, but it was something we could adjust to. We were well briefed by the teachers, and the system aided our examination by providing clear and concise information. Lastly, I would like to talk about our clinical experience during COVID. As year ones, we will be attached to community hospital for our first clinical posting, which just recently ended last December. However, there was an issue at the start. Most of the community hospitals were not open to accepting student nurses due to COVID, as most of the patients in community hospitals are vulnerable elderly. This limited the opportunities that were made available to the students. Therefore, the clinical team split the cohort into two groups to have our posting on two different block of dates. The first group went for their posting from 7 December to 18 December, while the second group went for their posting from 21 December to 31 December to the same hospitals. And since there were limited options, we were not able to choose the hospitals of our own choice, but rather assigned to them. However, we were given the option of switching between our friends. As for the seniors, some of their attachments were cancelled or postponed during the starting stages of COVID. Thus, when going back for the clinicals now, they felt that some of their skills were rusty, but also served as a good refresher for them. In particular, COVID did compromise our learning in clinicals, as some of the things we would have been able to observe or do were not possible due to COVID restriction and the tighter hospital policies. One of my seniors told me that she was unable to see the birth process happening as it was not allowed during the phase of time with the safe distancing measures put in place. Nevertheless, it was still a very fruitful experience for everyone. In a nutshell, even though there was a lot of uncertainties at the start, learning during COVID became relatively manageable as the teachers and students supported one another in adapting to the new norms. Despite having to sacrifice some aspects of our learning and turn to alternatives instead, I was able to learn all the things I had to learn this semester in new and creative ways, thus conquering challenges and adapting to redefined norms in learning. Thank you for your time.
Hey, so thank you so much. Okay, Suvata. Now they have a question for you. Number one, okay, yeah, so exciting, wasn't it? What was your most favorite educational platform?
As in like the one that we interact with. Okay, so if you're talking about like the platforms where we use for like to like questions answer questions, then it's like Kahoot. So teachers always used Kahoot nowadays, and that was really fun for me. And then there was also this other thing where it was like this thing called polls or something.
Mm.
So we use that, and then like it's like we can read other people's opinions, and then we can comment on it as a class, which was pretty good for me. Yeah.
So my to add on to that question,
Yeah.
my question was like after using all these educational platforms,
Mm-hmm.
how because COVID has changed the whole entire way we lived and the way
Yeah.
we do things. So now how do you think you possible use Kahoot to do a health education to your elders or health education to the hospital patient or whatever it is? No, I mean it may be too raw for you because you are pretty new. So I'm just saying that when you have used all this educational tool now, all this
Uh-huh.
educational platform,
Yep.
how if one day you have to do a health education,
Mm-hmm.
do you think you will use all these educational platforms to help you or to
Yeah.
or no or which one then you will think you want to use in order to do this health education?
I
No.
think I would definitely, if I'm going to teach people, I think
Mm,
all these platforms that we used online, there was this new things that popped up, and I think it really helped because it really, like, for Kahoot, it's like this competitive side of, it brings out the competitive side of people, and then it makes it like more engaging and interactive, which is really important when it comes to like learning. So I think I would definitely use that, and then the polls also, because it really helps to see like different opinions of different people and then like discussing about them. So instead of just it's like a one way of interaction, two-way, it being two-way, it's like more engaging. So I would definitely use it in the future. Yeah.
yeah. Okay, the second question posed by Salini. Okay, have you ever felt shortchanged due to this restriction?
Um, what does it mean by like
Okay,
shortchange?
like okay, there's a few things to look at. There's also a question in the pigeonhole. Ask you, do you think you and your classmate was shortchanged in terms of practical session? So number one is practical session. Number two, you pay so much, and then you guys are stuck at home and then
Yeah.
doing your Zoom. Not that nobody's doing anything, but I'm not. No, so but you have to pay the school fees and things that stuff. So do you felt that I am doing online? Yes, I don't have to wake up so early as what you say, and but in real life, okay,
Mm-hmm.
nursing is a very skilled thing. Do you think you're
Mm-hmm.
shortchanged? I think that's what Salini is asking.
Okay, so actually, I was pretty bummed when there was no anatomy labs because I really was looking forward to looking at the cadavers and learning. But honestly speaking, the teachers really like put in a lot of effort to like show us more pictures and like more like 3D dimensional views so that we actually really understand like what we're looking at. But still, there is like a part of me that's always like a bit sad that we haven't gone inside the anatomy labs. And as for the lab sessions, the nursing skills, so we had it like alternative weeks of like lab sessions, so it would be like 4 hours instead of like shorter lab sessions each week. So during the lab sessions, the teacher really did make sure that we were able to practice all the nursing skills that we're supposed to know before our clinicals. And then once we went for the clinicals, that was really a very, very important experience for me because I was really able to practice a lot more than like what I've practiced in school. So I think the clinical plus the school really like made it more okay for me, like the whole experience together. So if it was just school, then it wouldn't have been as fruitful compared to having together with the clinicals because I was really able to practice more of my nursing skills there.
Yeah. Okay. So I'd like to hear your views because now we are like into zone A, zone B, or team A, team B.
Mm,
And when you are in one sector, you cannot cross over to the second sector.
mm,
However, you may see that in the second sector, you made a very interesting case that is for your learning, and now you can't cross over. And your
mm.
maybe your sector A is all the quite simple case, quite boring, that stuff, no excitement. And then the B case is, oh my God, they got all the emergencies, they got all the things that they do, and you can't actually go over there. So how do you feel?
Actually, okay, for my clinicals, I think I was the lucky one. So I got the more because I was in dementia ward, so it was pretty cool, like seeing all the different things, and there's a lot of things to do. So I was pretty happy with mine. So if I was not in mine, maybe I would feel like a bit sad that I cannot like go over and like see other things. But I think like I feel like because we have like over the years, that I feel like we'll be able to catch up on it. Yeah, like because there'll be a lot more clinicals that come, so it's just like having a more positive attitude and like being more proactive. So like next time, maybe because since I missed out, like now I'll be like more active next time to like try to catch up on all the things I've missed out. Yeah.
Okay, that's quite positive because now you're entering year two and
Yeah.
we are still at COVID state.
Yes, a bit.
Well, yeah, have fun in the first place. Okay, Cynthia was asking another question to you. Okay, so thank you so much for sharing. You did a great job. May I clarify? You mentioned that the skill module was assessed via a written assignment. Is this the only mode of assessment? Question
uh
two is okay. Answer the question one first, then ask you the
okay,
question two.
so for that module we had a written assignment, but that wasn't the only one. That because apparently I heard that when we went for our lab sessions, the teacher secretly assessed us, which I didn't know at first, but then I heard about it later on. And then there was also there was also a group discussion, group presentation that we had to work on together. Like we have to present a case. Yeah, so there was more than that. And then for the second question,
Yeah.
how many percent of the skills module were converted to online learning?
Yeah.
Like what does that mean? Like,
Okay,
oh,
so if you need to do assessment on health assessment, and it's all converted into online, or you need to, is it like you need to do communication, was supposed to
uh,
be live, and then it was converted into online. So how many of this supposed to be practical was converted to online? Because I know NUS has a
mm,
different way of doing things. Mostly are all online, except you go back for some practical, right?
yeah. So the for the lab sessions, usually for the online tutorials, so example for the fundamentals of care module where we have like the nursing skills. So only the nursing skills where we had to like wound dressing, transferring all that, like all the things that we had to know, we had to go to the lab to do it. So before that we have like the preparation tutorials where we like learn about it like theoretically. So that was all online. There was like no classes for that. Then for the communication module, everything was online. There was no like face-to-face interactions. So just they just like changed the rubrics for us. So we know when we're interviewing the patient, there might be like parts where we have to like touch them and be like, oh, it's okay and stuff like that. So that kind of like physical touch, like they don't care about it anymore because like we can't do it over online. So they like assess it differently. Yeah.
So is it like 50-50, like mostly tutorials are
I feel like it's more
online?
70% online and 30% like offline.
Okay,
Yeah.
okay, okay. Okay, so question 3.
Is there any difficulties? No, actually, there was no difficulties because all the nurses were very, very, very nice, and they really like teach us a lot. So even if I didn't remember anything, they would be like, okay, you do it this, and then like then I just can do it. It's like very nice.
Okay, what one of the things that the directive was no in one cubicle of 5, including the CIs and 2 students and the patients, is not to be 5. So do you think again this learning itself affects you at all? Because we go into very, very small group. When you
Mm.
guys come in, it's only like 2 students to 1 CI in 1 cubicle, or 1 staff in 1 cubicle if you need to do any teaching. And then you are somehow like, if you are in the whole entire cubicle, maybe you and your friend is managing like 20 patients or something like
Mm.
that, right?
Mm. Yeah, cause so I went for like the community hospital. So I was like in dementia ward. There was like around like 15 patients, and then there was 2 student nurses, I think. So I was from NUS, and there was like someone from Nian. Yeah, so I think when I was there, I didn't feel like there was any like problems per se. I felt it was pretty good. I don't know, it's just me. Like it felt really like normal because the CI would come in and like she would talk to us anytime like she to assess like all the things that we have to like do, the our skills that we have to complete. Like she would just do that, and then she would like go after like teaching us a few things. And then the nurse, cause and we were attached to like a nurse there every day, so it was like pretty good following them around, like doing all the things they did. So
Okay.
yeah, so for me it was pretty good. Like yeah. But my seniors, when I was talking to my seniors, they did say that like some, because I don't think like seniors they would get attached to anyone or like be like following around people. So they felt like it was like a bit more like less how to say, it was like more lonelier compared to like last time, because last time they used to be able to like go to other like boards and like see their friends and like learn whatever the cases they have. So it was like a bit lonelier, but still they were able to like do things. Yeah.
Great. So keep the positive expect moving. Okay, the attitude move on. Everybody is now on supporting you. I know it's a very tough thing for students. Okay, not that it's tough. It's not easy. It's not easy as well for any one of us as well. So thank you so much for coming today, and thank you so much for giving the talk to us.
No problem. Thank you so
Okay,
much
thank
for having me.
you. Yeah, bye. Okay, so Cynthia says that thank you so much, and it's lovely to hear from you. Wish you all the best in your learning and in your nursing career.
Thank you
Okay,
so
thanks
much.
Cynthia as well. Okay,
Thank you,
so
Cynthia.
Okay, so the next speaker we're going to have is Samantha. So Samantha is the nurse educator of Parkway East Hospital. Okay, she was there for literally 16 years. With 16 years experience of nursing. She joined Parkway Hospital in 2017 and is actively involved with the training and developing of nurses in its 4 hospitals. Now, Samantha strongly believed in lifelong learning and has over the years attained her advanced diploma in nursing, medical and surgical, a bachelor of nursing, a postgrad diploma in nursing management, and a postgrad diploma in higher education. She has experienced nursing patients with acute stroke, orthopedic, medical, surgical, dermatology, infectious diseases or conditions, including ICU and high dependency patients during the H1N1 epidemic in 2009. She also foray into the nursing homes where she recruits and trains nurses in providing nursing care for patients in their own home. So without further ado, I will hand over to Samantha. Samantha, over to you.
Okay. Thank you, Prof. Just give me a moment to share my screen. Okay, you all should be able to see my slides right now already. So thank you, Prof, for the kind introduction, and thank you to everyone for logging in to listen to our sharing today. The title of my topic is Remaining Training-Centric Through Times of Crisis, Our Journey. And before I start on my topic, let me just give a little bit more of an introduction. Prof has already mentioned that I'm a nurse educator at Parkway East Hospital, and he has also mentioned the certifications that I obtained over the years. One thing that was not mentioned so far is that people may be familiar with Parkway East Hospital, but some may not know that it's actually under a bigger group called IHH Healthcare Berhad. And under this group, first of all, IHH Healthcare Berhad is a leading premium healthcare provider in Singapore, Malaysia, India, and Turkey. It also has a growing presence in Greater China, and we are also expanding in Asia and Central and Eastern Europe. So you can see that global footprint over there is quite a few countries. And over here in Singapore, we have 4 hospitals and 50 plus clinics all over Singapore. You may be familiar with the names of the hospitals. Firstly, we have Gleneagles Hospital. We have Mount Elizabeth Hospital, Mount Elizabeth Novena Hospital, and Parkway East Hospital, where I am stationed right now. Okay, so now that I have introduced IHH, let me just go down to my topic. Firstly, I will be talking about how COVID-19 changed the nursing education landscape in the hospitals and the strategies that were implemented to overcome the challenges faced and the way forward in the year 2021. I'm sure everyone is familiar with the timeline of COVID in Singapore. We've all lived through it. So let me just give you a brief summary based on the nurse educator's perspective. So on 23rd of January, the first COVID-19 case came about in Singapore. It was a 66-year-old male Chinese national from Wuhan who arrived 3 days before that. And in February 2020, all hospital courses and in-service training were cancelled in view of the worsening situation. On 7 April, the circuit breaker came about. And on the 14th of April, the mandatory wearing of masks came in also. So phase 1 started on the 2nd of June, and that's where businesses that did not pose a high risk were reopened, and we left home only for essential activities. On 19th of June, phase 2 happened. So more businesses reopened, students fully returned to school, and sports and recreation facilities were reopened. And it was during this time also that the hospitals recommenced their talks, their face-to-face courses and in-service training, but of course with all the safe distancing measures in place. And the most recent thing was phase 3, which I think everybody celebrated about. That was on the 28th of December, where there was a bit more freedom for everyone. So what was the impact on nursing education in the hospitals? We were in a dilemma because we could not compromise the safety of our learners, but at the same time, we were also unable to just put the building of the nurses' capability and skills on hold. And in order to give you a compendious answer to this question, I grouped them into 3 categories over here, so it's a bit easier to understand. The first is nurses, the second are learning needs, and the last is training modes and methods. Now, under nurses, different groups of nurses are affected in different ways. So the first group of nurses that I'll talk about are the frontline nurses, is those that got deployed to the front line. Firstly, they still had to complete their annual competency assessments. They still had to continue their professional education. They also had to relearn the donning of personal protective equipment. We had to reinforce this to make sure they were doing it correctly. And lastly, nasopharyngeal and oropharyngeal swabbing. This was especially important and had to be done quickly and effectively so that we could contribute to the national efforts off-site. And that included, as you can see from the pink box over there, border screening, which was in January 2020, mobile swab operations, which was from April to June, participation at the community care facility at Expo from April to May, where the nurses nursed the COVID patients. And lastly, the Swiss Cottage facility, which was from June to November. That was a really long period. For those who do not know the Swiss Cottage facility, this was where dormitory workers who have already cleared their first swab and were waiting for their second swab would be stationed at that point. The next group of nurses are those in the hospitals, the ones who stayed behind to hold the fort and to nurse the other patients. So these nurses also had to complete their annual nursing competencies. They also had to continue their professional education, and selected nurses also had to be trained to manage patients in the fever ward and the COVID ward. So we had this in each of the hospitals that I mentioned earlier on. And lastly are the students. This one, Savita has talked quite a bit about it. So I'm just going to say that, yes, their clinical attachments were delayed for some of them. And for all of them, the way it was conducted was a bit different, where instead of meeting their clinical instructors in the hospitals on a regular basis, they did quite a lot of updates through Zoom instead, and they had an on-site supervisor with them. The second category of affected areas are the nurses' learning needs. I already mentioned all of them, 100% of them had to be trained in nasopharyngeal and oropharyngeal swabbing. They also had to be taught again the donning of personal protective equipment, which includes the face shield and the cap. COVID-19 updates, they needed to be kept abreast of the latest things that was happening, with so many changes going on. They had to complete their annual nursing competencies, continue their professional education, and I think all the nurses out there, most of us who have experienced this, the BCLS courses were actually stopped for roughly 6 months, if I remember right, and some of our certifications actually expired. And as for pathway nurses, we have one more thing to handle, and that was JCI reaccreditation audit. We had to start familiarizing ourselves with the JCI chapters, make sure that we followed the guidelines, and make sure that we were ready for the audit, which happened in November. The last category that was affected were the training modes and methods. In February 2020, all face-to-face courses and in-service training were suspended. So nurse educators had to look through all the courses and in-service training that were planned, determine which ones were essential that still had to be continued, and how we were going to continue it. And in August 2020, when face-to-face training resumed with safe distancing measures, we once again had to look through all our training plans and determine, which ones did not really meet the safe distancing measures, make sure it was modified to fit it. And that included things like, you have learning activities during courses, and some of them involve quite a lot of interaction. So if we had those kind of learning activities, we had to make sure that this was reviewed to make sure that the safe distancing measures were still in place. So these are some of the strategies that we came up with during this period. The first is the increased utilization of the learning management system called Brightspace. This was used for nurses, especially for very simple training that did not require a lot of interaction, and it was mostly refreshers. So it's things like fire safety, radiation safety, hand hygiene, because most are very familiar with their 7 steps of hand hygiene and the 5 moments of hand hygiene. And if, let's say, there are trainings that required more interaction and a bit more elaboration by the trainers, we use online meeting platforms such as Microsoft Teams, WebEx, and Zoom over here. So participants could join in, and if they had any questions, they actually pose their questions to the trainer. For example, in June, we held a series of COVID-19 talks. And we invited speakers from infection control, the physicians, doctors from the obstetrics and gynecology, respiratory medicine, anesthesiology as well, to talk about their affected areas. And most importantly, we have our infection control nurse coming in to tell us more about the infection control practices. And lastly, we also encourage the nurses to attend webinars and other online courses by external organizations. For example, there is one called Coursera that is online. It offers online courses and degrees from established organizations and universities. And one that the Parkway East Hospital nurses did participate a lot in was this course called Mind Control. You can see on the screen right now, Managing Your Mental Health During COVID-19. This was conducted by Professor Steve Jordans and offered by the University of Toronto. Another strategy that we applied was for the annual nursing competency assessments. So senior nurses assess the junior nurses, but within their own department, we made sure that there was no cross-department assessment going on. And the progress of these assessments were communicated through regular communications among the senior nurses, the nurse managers, and the nurse educators. Another strategy was train the trainer sessions, and this was conducted when hands-on practice is very important, very required, where detailed explanations are needed, and there may be serious implications if it's performed incorrectly. So during these sessions, we maintained the 1 meter safe distancing, and we made the wearing of masks, of course, compulsory during that time. One example is the nasopharyngeal swab competency training. What happened is that senior nurses from different departments were selected to attend this session. So they first sat through a lecture that included the indications and contraindications of the procedure, the anatomy of the nasopharynx and the oropharynx, the correct technique for the swab, potential complications, specimen labeling, and how it should be correctly dispatched to the lab. And after they have gone through this lecture, there will be a demonstration for them. And this is the time that if they have any questions about the lecture content, they could actually ask it during this time. As you can see, that trainer actually drew out the nasopharynx and the oropharynx to give a better explanation. And after this, this is where the hands-on practice came in. And this was very, very important. I had to go through this training and I was assessed by a doctor, and she pointed out some things that I was doing a bit incorrectly at first. One was that I really thought I was directing my swab horizontally along the nasal floor, but it's only when she took a video of me that I realized that my swab was forever pointing upwards instead. So that was something that I had to correct. And secondly, I had a tendency to lean close to the patient because I wanted to visualize the nostril. I didn't want to poke the patient's lip by accident. So I was advised against doing that and to be more conscious of it. So after this hands-on practice, once the senior nurses were confident in the procedure, they were assessed by the nurse educator. This was to ensure that they are competent before they are deployed back to their departments to train and assess the nurses over there. Two more strategies that we implemented was blended learning. Blended learning, as most people will know, is a combination of e-learning and face-to-face training. So participants were first given an e-learning component to look through around 1 to 2 weeks beforehand, and then they attended a physical session to consolidate what they have learned. And this is the time that if, let's say, they did not understand anything in the e-learning, they could ask questions and have a discussion on the content. The next is face-to-face training with Microsoft Teams. Okay, let me explain this a bit. Is to facilitate interactions among the speaker and the participants. And as you can see from the photo, what happens is that we have the speaker over there with a controlled number of participants who maintain the 1 meter safe distancing. And everyone else was logged into Microsoft Teams where they could watch and listen to the speaker as well. So the people who are physically there could just voice out their questions as per normal. And those on Microsoft Teams could either type in their questions on the chat or unmute themselves and ask the questions then. And lastly are protected code blue drills. These are code blue drills conducted especially for when we were anticipating any resuscitation for COVID-19 patients or suspected COVID-19 patients. So we took the existing Code Blue drill assessment that we have, this checklist over here, and we reviewed it to accommodate COVID-19. So for example, it may be too small for you to see, so let me just explain it. The first part is to wear the PPE before you perform chest compressions. And the other part over here is to avoid aerosol generating procedures. So they won't insert the oral airway, but they will perform oropharyngeal suctioning, and they'll also bag the patient as per normal. So you can see the pictures over here, the nurses doing their protected Code Blue drills, fully gowned up with their face shields and their masks, and they're doing chest compressions on the mannequin over there for practice. And with any implemented strategies, anything new, there's always the challenges that we face. The first is that certain e-learning courses are less engaging, and that is because you're basically reading slides sometimes. So some people may feel less engaged or may not understand with the content. And how we got around this is by using PowerPoint voiceovers, where you insert the audio inside there. So let me just play you an example of what one may look like. This was recorded by a pharmacist. Okay, and for those who maybe could not catch that, let me just summarize. Firstly, what you saw is that red box over there appeared, which directed the participants' attention to the area that the speaker is referring to. And the speaker actually said, so for high intensity statin therapy, I mean this portion. So she was verbally directing them to that area also. And secondly, she elaborated on it. She said, regardless of the cholesterol level, this is recommended. And I do find this a bit more helpful rather than just reading the slides and trying to understand it also. Okay, another challenge was that there was no avenue for questions or clarifications in the e-learning courses. Like what we mentioned, they are only able to look at the slides. So what we did is that at the introduction of every course, they will have this message coming out. So if they had any login or technical issues, they could contact the IT people with their email address over there. And if there's anything related to content, they could contact the course instructor, and an email address was given as well. The next thing is that we encourage them to use the e-learning forum. And this is a place where they could post their thoughts, their questions, or any opinions that they had. For example, you can see on the screen right now, there's this person who attended the basic counseling course. And she actually posted her opinion over here about the art of listening. Like she says over here, listening with an open mind can be very challenging. And then at the end of it, she said, just my thoughts. So it's very nice to see these kind of messages, knowing that they have gone through the course and they, of course, have their own opinions about the content. And for some, what they did was validate the usefulness of the course. Like the one on top, she says she attended the drug use in stroke course, and she says it's not common in her area, so it's a good refresher for her. And some others just posted very sweet, simple messages of appreciation, like thank you for sharing, thank you, and no questions to ask, thank you. And I think a lot of us who have experienced this, it was very, very difficult during this time for less IT savvy individuals. Imagine if you are one of them and you will ask these many things, okay, to download this app, download that app, download this so that you can attend this meeting, log in using your account, find the course in your e-learning platform, and sometimes they had difficulty doing that. Right in the forum, this was something that they had to learn also. Complete the course, which amazingly quite a few had trouble with because they had a tendency to not go to the end slide. So the system could never mark them as complete because of that. So they were very confused by this. They were asked to complete the quiz. And if they're in an online meeting where they have to give a presentation, they had to share their screen. They had to turn on the video. And very tricky here, they keep unmuting and muting themselves at the wrong times. So this was very difficult for them. So what we did was give them a lot of tutorial guides to help them through this period. Like the one over here, it shows them how they can access their Brightspace accounts, which is the e-learning platform. And on the right is how to troubleshoot, because we realized that a lot of people face these certain issues. So we gave them this guideline so that they could just follow it. And at the end of it, I don't know if you can see it, it says to contact the nurse educator if they still cannot figure it out. And also we provide support for the speakers themselves, because some of them would not be used to online meeting platforms also. And we did not want them stressed out with this kind of issues as well. So what we did is that when they are giving their talk, we have somebody there providing IT support. So if they face any issues, all they had to do was just alert the person and the person will come in to help. So it was less stress for the speakers. This was a simple challenge actually, no physical attendance registration. So, normally nurses will attend talks, they'll just give their ID, they'll just scan it and their attendance is registered. So for this, there are many, many solutions. And what we use is something called Microsoft Forms. So at the beginning of the talk, they are given this slide over here that instructs them to go to the chat room to click the attendance link to register, or they can scan the QR code over there. And then they'll be directed to this online registration form where they just entered some details. And that was it. It was very simple. So not many people had issues with this. The next were disruptive online training sessions where, it's understandable. Sometimes you forget to mute yourself and then you come in and then the speaker gets a bit disrupted because suddenly there's some noise going on. And what we did was to, of course, give a reminder at the start of the session to please mute yourself. But accidents do happen. And we do have somebody on standby who will just look out for those who are a bit too noisy and mute them for them. Another is unfamiliarity with self-application of CPE points. The nurses, like I mentioned earlier, were encouraged to attend webinars and online courses from external organizations. So the nurses had to go into the Singapore Nursing Board website to self-apply for points. And it will look very daunting to some people when they see this kind of form. And how they resolve this is by approaching their nurse educators or their colleagues who are familiar with this and do the self-application with them. And now that I've talked about challenges, let me talk about the opportunities, because there's always good and bad things, right? So for the opportunities, there was way better accessibility to talks and courses. You realize that during this whole year, last year actually, during that whole year, more courses and talks were done online, and that improved accessibility to all of these things. I myself really enjoyed myself because I discovered Coursera and edX, and I found so many courses online that I wanted to attend. And the National Library Board also has an app where you can download lots of ebooks. So you had a lot of learning opportunities. Another example is the IHH Trust Nursing Leadership Symposium that was held by Parkway. That was in October 2020, quite recently. This was held virtually, so it brought together 11 speakers from 7 countries across IHH. It was, I don't think it would have been as successful if, let's say, it had to be done physically instead. And it was attended by an estimated 2,000 participants from those countries as well. So blended learning was another thing that was really good. I mean, we already had blended learning for some of our courses, but this forced us in a way to implement more of it in our courses. And we all know that blended learning it does give the participants flexibility, which in turn engages the participants and improves the learning outcomes. And all of us became more techno-savvy because of this whole situation. Okay, and lastly, the achievements that we have for this year. So despite all these limitations, right, we still managed to achieve a lot of things. Firstly is that 100% of the nurses were trained in all the essential training that was required, like the nasopharyngeal and oropharyngeal swab training. Secondly, despite the nurses nursing COVID patients from all areas, the nurses going sometimes to the different hospitals for training, that we had no hospital-acquired COVID-19 infections, and we had 0 staff infections from caring for COVID patients. And the Singapore Operations Division will also achieve American Nurses Credentialing Center, meaning the ANCC is actually an accreditation that recognizes high-quality nursing education courses. Okay, and some success factors. The first is I do have to mention our really, really supportive leadership. Remember I mentioned mobile swab operations earlier on, and we were at the CCF as well. We had all our hospital directors of nursing going on the ground with us, wearing the scrub suits, wearing the PPE, and perspiring right along with us. The second is the really great teamwork, especially among the nurse educators and the infection control nurses. We worked very closely during this period to provide PPE training and swab training as well, and make sure that our training complied with all the infection control guidelines. The next is resilience. I didn't really want to post any pictures of sweaty nurses. So I would just say that we were really very resilient during this time. We worked longer hours, we perspired like crazy, and we held ourselves well during this period. The next is the good, effective communication. We did this through regular MOH circulars and instructions that were disseminated as quickly as possible. We had a Singapore Operations Division Command Center for regular updates. We held regular virtual meetings, town halls, and roll calls to make sure all the nurses were kept abreast of the ever-changing situation. We had an Ops Command Center for daily head of department huddles. And we put up posters in public areas for visitors and for the nurses in the wards and the staff pantry as well. The next word is the high adaptability skills. As mentioned earlier also, we had to conduct nasopharyngeal and oropharyngeal swab training really quickly, and it still had to be very effective. And it was done so well that Parkway was actually engaged by QM Dental and the Ministry of Social and Family Development to train their swabbing volunteers as well. And lastly is the focus on the staff well-being. We made sure we conducted mental wellness talks. We gave care packs to staff, which included vitamin C, and there were all these herbal teas going on at the cafeteria where we could drink it to stay hydrated. And we had staff counseling readily available for anyone who needed it. And lastly is the way forward for the year 2021. I think it'll be a very exciting time also. It will also be challenging. And one thing that I see happening maybe a bit more is simulation training. And I know we're doing it right now, but I think more of it may happen. And one thing that may also be implemented is standardized patient simulation, where the use of individuals trained individuals are used to portray family members or patients, and nurses could actually practice their assessment and patient history taking on that. And lastly, I think there should be more courses and in-services that inculcate critical thinking and an eagerness for continuous learning, because I think this pandemic has really underscored the need for nurses to be trained to handle and anticipate questions and changes quickly. So I've come to the end of my sharing. I hope that you enjoyed it, and yeah, if you have any questions, just feel free to ask me. Thank you.
Thank you, Samantha. Thank you very much. I see whether there's any question first or not. Okay, so far, not in my question box. Now there is 2 questions in the pigeonhole. Okay, so the first question was to ask your opinion, because in terms of teaching again, because certain people have controversial policies. They say everybody must wear a mask, and on top of the mask, you must wear the face shield. So in terms of from the educational point of view, should you think we don't wear a mask and just wear the face shield, or have to wear both? Because this is a double stress for educator, because no, for the nurses in the hospitals, unless it's only doing major procedures, then they have to wear. So generally they don't have to wear it like throughout. But if you are teaching a whole day, what is your thought? Whether you need to wear the mask and wear the face shield?
Do you mean as in whether the educators should wear the face shield or nurses in general?
Now what's your opinion?
Okay, for the educators, I would say it's not necessary because we are teaching, but we will wear our usual surgical mask. But infection control has already advised us, as long as we are giving aerosol generating procedures, or if we are on the front line, definitely we need to wear the face shields already. Okay. And of course the N95 mask. Okay, yeah, because the MOE and then the MOH somehow have certain criteria, and of course certain teacher will say that, oh, okay, wear face shield and don't have to wear face mask. Then we are like, okay. And then because they say, oh, I got asthma, otherwise I can't breathe, I will get into asthma stuff things. Now the other question is because once the COVID started, right, then all the online business became a very big business. All the online teaching, and again,
what is your thinking of sharing resources? Because I think one of the thing is for nurses, I won't dare to say for the rest of the people. I mean, for nurses, um, if some if one organization is like the big is the lead runner and have developed that, uh, wouldn't it think it's better to share the resources rather than reinvent the wheel and then we have to redo all this over again?
Yeah,
So
that's
so
true.
what's
As in, really, yeah.
yeah
I mean, if it's
yeah
already been done, I think it's good that we can share our resources because everybody needs to learn,
yeah
and everybody is in this situation together. So
correct.
yeah, I think it's good to
So
actually share our resources.
okay, so of course then it comes into the IP issues lah,
Yeah.
who has the IP issues, who safeguard, and where do you think is where can we like store it so that everybody can use for nurses? Is it the Singapore Nursing Board or is it the Singapore Nurses Association? Is it is it the school or whatever is So don't know what is your thought? Just thinking your thought as well. Like
Hmm. We're
should
talking
the
about sharing.
association, yeah, because like should the association take on bigger role and then say that okay, we all share because we're all nurses, we are all inside this association, and then
Hmm.
to help all the nurses, okay, if we have put something inside there that we can say can be shared, so it save a lot of problem lah. That's my thought lah. Got no hidden agenda.
But I do think, I mean, like right now, what we are doing, all of us invited over here to share our thoughts. I think this is a
Yeah,
perfect place to
yeah,
actually share
correct. Yes,
everything
yeah,
because we are talking about what we have experienced, what
correct.
we have learned. And if anybody has any questions, yeah, they can ask it over here
Yeah,
as well. So this
yeah,
is
correct.
a perfect way to
Yeah.
do it also.
Yeah, correct. Okay. There's one question for you, I think. Can you see the question? To comment on difficulty to submit CPE application
Ah, yes.
is so frustrating. I have submitted on my own to SMB for CPE points, but it was rejected. It was rejected. Reason given that since I met requirement, SMB is not going to approve anymore. How best can we overcome this as SMB is not at all supportive to give CPE points for continuing education?
I wouldn't say that the Singapore Nursing Board is
Yeah,
not supportive, but
yeah,
they do encourage nurses to achieve at least 15 CPE points.
yeah,
So
correct.
they are not stopping you from attending, other training sessions out
Yeah,
there.
right.
It's
Yeah,
just that they are taking note that you have already achieved the requirement for
yeah,
that qualifying
right.
period.
Yeah,
So they are
but
definitely not discouraging you from
yeah,
doing anything further.
yeah. Yeah, so to add on to Samantha, everybody is just like you just need 15 CPE points for SMB registration. So far, it's not a mandate thing, but it's good
Mhm.
that you have. But you have overshot. Don't bother to go in now because as long as they have 15 points, it happened to me a lot of times. So each time my name go up, it say reject, reject, reject because it's over. So I told them don't bother anymore because as long as they're 15, remember it's 15. Okay. As long as maybe it's a good thing, as long as SMB rejected your CPE point means you're safe lah.
Yeah, that's a good problem to have.
That's a good problem. Yeah. So don't get frustrated. Like means they're telling you well done, or you have done a lot of cost in the first
Yes.
place. So yeah. But unless you're saying that the organization require a higher point. That is a different thing.
Mm.
Then you have to work out with your own educational department or your own HR department to work out the leeway how much you need the point. Because I think in SMB is 15. I don't think anybody in Singapore or the DNs will not say I want 20 for my nurses. Right, huh? Parkway also 15, right?
Yes, also 15.
Yeah, so all of us are 15. No, so yeah, so thank you so much, Samantha, for giving such an interesting talk to all of us. And
My pleasure.
yeah, thank you,
Thank
thank
you,
you.
Prof.
Yes, okay. So I will introduce the next speaker, okay, which is Jessica. Okay, and Jessica going to give a talk on the challenges and adaptation in training during COVID-19. Now, Jessica uh, is quite close to my heart because she we used to work together in Amokyo, and she went for this first disease management as an advanced diploma okay, all by herself. She doesn't want me to sponsor her, something like that. So then after that, she had been running this disease management self this nurse led program again in Ang Mo Kio. We set up something like that. So she quite um, quite on the ball. And then she moved out, okay, and then she took on higher roles, and then she also obtained her master's in education in Queen Margaret University, and then she took on a bigger role in one of the nursing homes, okay, as a NM. And after that, she was offered as a director of nursing. She called me and asked me how. I said, take lah, what are you waiting for? So she took on, and then she moved over to a bigger organization now, okay, which is Suryana, and she's now the director of nursing in Suryana nursing home. So Jess, over to you now.
Thank you, Prof, for the very kind introduction. Yes, Prof is my mentor. When I have difficulties, I will always go back to him. Okay, and also thank you, SNA, for I'm very privileged to be invited as a speaker for their first webinar from the Education Committee. I will just share my screen first. Sorry, can you see the screen or no? Okay, can. Okay, to all the participants, thank you for joining us this afternoon on a rainy Saturday afternoon. Okay, my name is Jessica. I'm currently the Director of Nursing with Sri Narayana Mission Nursing Home. So before I start, right, because the name of our nursing home is quite a mouthful. So during this presentation, I will just use Sri for short to refer to our nursing home now. Okay. Today, my segment will cover whether just to share whether training is actually appropriate during COVID-19, the training options during circuit breaker, challenges and opportunities, and from the learner's perspective and trainer's perspective of training during this pandemic, and sustainability and the future. Okay, so with the current pandemic impacting the entire planet, you know, the consequences of which actually remain very difficult for us to predict. So talking about training and support, you know, some people may think that, oh, this is ridiculous. Why are you even talking about training? You know, so in fact, during circuit breaker, many people are actually very worried about losing their jobs. Even when they're holding a job, they're actually quite uncertain about the future of their jobs. And then working from home also has their own problems, you know, with young children, and then having whether they have the IT support, and training is probably the last thing on their mind, you know. So, but in healthcare and all services or sectors related to people or looking after people, especially in healthcare, training doesn't stop. And the issue of continuity of activities and services, in fact, is very essential. And in fact, because it's unprecedented period, right, uncharted waters, we need to quickly learn. And so that we can actually stay updated and current, because for healthcare, it doesn't stop. It has to continue. So in fact, training and capacity building have been a critical pillar in this recent outbreak. And an outbreak of a new disease comes with many gaps in understanding. The biology of the disease, the virus transmission in human society, the disease perceptions of affected populations, and finally, the treatment and cure of the disease to minimize the impact of the outbreak on individual lives and society as a whole. You know, all this information need to be communicated to the staff through training. So the nursing home had to quickly develop new solutions on time to meet the demands of partners, you know, And then MOH and AIC, they have been churning out advisories within a short span of time, and the nursing home had to really quickly develop new solutions. And to ensure that all responders can implement control measures promptly and adjusting the routines of healthcare provision. So is training appropriate? Yes, I would say very appropriate. Okay, training is in fact needed that will actually effectively and efficiently bring every employee up to speed on who is responsible for what, and then help them feel aligned and knowledgeable and of what is expected of them. The burden then falls on the shoulders of the educators and all the players involved in delivering healthcare and essential services to ensure that our staff can learn, adapt, connect, and succeed in delivering the response needed to minimize the risk of transmission in our home. It is like a race against time. Everything has to happen very quickly. So what some of the disruptions that we had in the nursing home, because of the abrupt nature, right, of the pandemic, it didn't allow us for gradual adjustments. We had to act fast. A little background on our home. To adhere to safe distancing measures, we were unable to meet with our staff physically. In fact, for our home, as early as February last year, our home started zoning. So our home, we have 3 residential wards. We first segregated by levels, and subsequently we split the individual wards on each level to smaller zones. Individual zones have a designated group of staff where they also have their meals in their own zones. In fact, we converted the home available spaces in the home as living quarters. So they actually live and work on the same level. Okay, and because the staff are split into teams, we had to change the way we conduct lessons. Because as part of infection prevention and control, the staff from different zones, they cannot cross over and mix. And not only are we not able to meet face to face, right, we are unable to have big group of staff together. So options, okay. I would say that the responsiveness of everyone involved has been admirable, okay, which can be seen in the almost immediate availability of a number of online resources, Zoom, Microsoft Teams, Google Meet, WebEx, etc. So using technology, which, it used to be a simple method, hybrid method of training. It's not the only option available during that time. It's either do or die. The only option that we had during lockdown was really to go virtual. We had to quickly have access to selected resources and platforms at that time. So I would say that there were many teething problems in the setting up of this form of communication in the beginning, because we are trying to meet the demands of a very large department on a daily basis. We're talking about the nursing department. Because the team is now split into smaller groups, we need more devices in order to deliver the training to a larger audience. And all the staff needs to keep abreast of the evolving knowledge of COVID-19 disease and its clinical cause as well as management. So the intelligent sourcing and sharing of learning resources will be beneficial to all involved. So in the beginning, we had a few hiccups. For example, we downloaded the app, but the device was not able to support it. And then we had situations where there was video and no audio, or when there's audio but no video, So and even the broadband in the home, the Wi-Fi, we really needed support in all that. So there were teething problems. Okay, so what are the challenges that we faced during the pandemic when delivering training? Okay, first was getting the staff together, because the manpower demand is so erratic, and then and it also carries the risk of really I would say the staff getting really tired and then fatigued, because we actually there was an increase from the 8-hour shift to a 12-hour shift to compensate for split teams and zoning requirements. So now the team is actually split into different teams, and then further split into different zones. And I cannot run on 3 rotating shifts anymore. So they were actually assigned on 12-hour shifts. And second was, of course, the technology. Face-to-face teaching was withheld, so we had to make a transition from didactic teaching to web-based learning. And with several resources available, right, the dilemma is then in the selection of appropriate platforms. The stability of the network and whether we get kicked out of the session, after a certain period of time, etc. And we also had to deal with challenges like IT infrastructure support, technical glitches, and then funding issues, etc. So, and also skills demonstration cannot be fully achieved via webinars. So clearly, I would say that digitalization enables more learning to take place online, but there are variations in access to technology and suitable learning environments, as well as management support. For example, because they are in the ward when we conduct the training, right? The ward sometimes can be very noisy and busy. So there's a need to circumvent challenges also, such as speaker inaudibility caused by speaking from a distance from the microphones, statics, and then muffling of the voice because we have our mask on. And I tell you, it's no joke when you're doing training and then you have your mask on, you feel so breathless when you're talking. Okay. So this is actually what we did. So because we are in individual zones, right? So the staff, about 3 to 4, when they are in their zones, they will use one device where they will where the educators will deliver the training. So if you can see from the picture, right? They have to maintain their safe distancing and they're so far away from the small little device. So sometimes audio can be a problem. And if I have PowerPoints, I don't think they can even see. So what we did was we actually have printouts. We are not printouts, sorry. We actually send the slides to them before the lesson so that they have something to refer to. Yeah. Okay. And then we are particularly concerned about skills development that may be less easy to replicate online. Because for Sri, right, we deliver the ITE Skills Certificate Program in home care. So teaching sessions on various topics such as wound dressing, lifting and transferring techniques, skills-based, it requires a robust interaction between the trainer and learner. So the need for social distancing has curtailed all these meetings. So in Sri, we covered the theory-based modules through web-based learning as much as we could before we went into lockdown. And then subsequently, the ISC program was suspended from, I think, April to July last year. So, yeah. So on a brighter note, the training program directives, mandatory competencies and courses have come under urgent review to lessen the impact of these disruptions. So a large proportion of courses have been converted to web-based sessions, and using a different delivery vehicle, these sessions continue to enable learners to participate in mandatory courses, and we gradually resume competency assessment on hand hygiene, donning and doffing, environmental cleaning, which was conducted face-to-face with adherence to safe distancing measures. Yeah. Okay, so because we have annual competency, skills competency, so especially for donning and doffing, and then we have new staff where we had to conduct induction program, and I actually started the EN competency program as well. So all these, it doesn't come to a stop because of the pandemic. We just have to find our way around it and take calculated risks, and then continue with the training. Yeah. So similarly, our partners have delivered multidisciplinary and expertise-specific webinars open to the network to ensure knowledge and lessons shared within the community of responders, and then strengthening the capacity across the network. So we are quite fortunate. So from the initial days of anxiety and uncertainty, we quickly improvised and adapted our structures and processes to find novel ways of delivering training. We are also very grateful because we work closely with a Kutek Kuat Jerry Care team, and they have been providing tele-CPE for our nurses regularly. So this has not stopped. So we are very grateful for that. And then also very grateful to AIC. Like what I said, one of the challenges we had was we didn't have enough devices because of the zoning. We needed additional devices in order to conduct training. So we actually managed to get this refurbished or repurposed tablets from AIC. So quite a number of them. So we were able to better deliver our training. And also to involve a larger audience as well. So after all the troubleshooting, trial and error, right, the virtual sessions have actually shown effective delivery of information and also enabled robust discussions. So in the beginning, of course, because they were in such a busy ward, what we did was we selected a time where the residents are having their nap time. So it was less noisy, less busy during that time, and then we conducted the lessons. So yeah, these are some things that we actually have to improvise very quickly, like through trial and error. And then in the beginning, right, everyone was like just fighting to talk over everyone. So what we did was the facilitator will actually be the one to facilitate. Okay, for example, what one zone one, any questions, you know, and then they will asked to actually mute their microphones until after the whole delivery of the lesson before they ask questions. So they have to, so it actually helped to facilitate the training sessions. So for COVID-19 pandemic, right, it has brought upon many unanticipated uncertainty and difficulties, really. So prior to COVID-19, we had the opportunity to hold regular trainings and ISC program. With the circuit breaker, we had to suspend the ISC program for 4 months, and trainings such as BCLS, AED were also suspended. So likewise, our nursing home, we had a number of nurses who had expired license. And then we were like, you know, every day we were like chasing the providers. When are you going to reopen the classes for us and all that? Even when they reopen, right, there were also some modifications to the certification. Yeah. So so moving forward, that's why we always learn when we always learn. So to stay positive, we are also planning to run our own BCLS AED lessons in future. Yeah, so we also realize that there are many opportunities which can be found in the midst of a crisis. So thankfully, of course, the improving health situation in Singapore has allowed us to move into recovery phase, and we were able to actually resume the ISC program and more trainings. Skills-based training will also resume now with health and safety measures in place so that we can actually connect with the learners once again. Yep. And also likewise, BCLS AED certification course resume in September. Yeah. So from the learner's perspective, they became more familiar with web-based learning and getting more inclined to technology. But their feedback is that web-based learning is not engaging now, so they cannot, they have limited interaction with the trainer. And of course, some learning needs of kinesthetic learners are not met as well. From the trainer's perspective, I would say that the trainers' feedback is that their confidence has increased in delivery of web-based learning, but still, I think as trainers or educators, right, they felt that there were actually minimal and no face-to-face interaction with the learners, which they don't really like. They would prefer the interaction with the learners. And also skills-based learning is not as effective as web-based learning. And to design the curriculum, right, is time-consuming. And conducting a class with a mask on may result in miscommunication sometimes because speech tends to be muffled. And logistic planning has to be redesigned to abide by safe distancing measures as well. Okay, so moving forward, COVID-19 pandemic has brought upon us a lot of unanticipated uncertainties and difficulties. However, we also recognize that many of the effects of the pandemics are here to stay. Okay, it's not going to go away. So we really, moving forward, we have to plan and see how we can actually enhance the skills of trainers in designing and delivering quality web-based learning through training maybe, and then send them for courses. And of course, new training curriculum will be designed in a way that to meet the needs of all learners, whether it's didactic or virtual platform. Key learning points from my own experience as a director and also an educator myself. It's not easy, you know. I have to get the feedback from the learners, from the trainers. Me being a trainer myself, I have to get the management to provide me with all the necessary resources lah. So the ability of my team to navigate this pandemic is really a very big credit to our very supportive management, and more importantly, I would say our people. The determination of the nursing department that quickly adapted and innovated to continue the training is a reflection of our passion for education. And the pandemic is actually testing the resilience and fortitude of the educator who rises to the occasion. I also see the part that my team has played. So I do hope to look back on this pandemic with a wiser perspective on training and education. So in summary, undoubtedly, the COVID-19 pandemic has been challenging in many aspects, but I strongly believe that the measures taken to facilitate training will definitely find their place in a less turbulent time in the future. So that's all from me, and I hope you have enjoyed my sharing. It's nothing fancy, it's just really a sharing of the challenges in the nursing home as a nursing leader and as an educator. Really not easy.
Thank you so much, Jessica. I share your sentiments as well. Oh, oh yeah, we all share the same thing. Now, one of the big things that I'd like to ask you, okay. Now, of course, CNO office, which is literally says that because of the COVID situations, a lot of the hospitals' clinical placement is being cut down. And then where will they look at? Then they want to focus on the nursing homes. So they says that all the nursing home in Singapore coming in the near future will have to take students. So and of course we have the discussion. So I just want to hear, what is your take in this this decision that's going to be is made already, by in CNO office and was already translated to all of us.
I'm actually very eager to take in students. I've been really waiting for the day. So in fact, I have actually submitted all the, okay, we are going to start with pre-enrollment nurses from ITE first. So we have submitted all the paperwork. The audit will be in May this year.
Oh,
yeah. So I am actually very happy to take in the students.
Okay. Yeah. Okay. So also looking at things like, well, compared to like, SAM and the rest of the hospitals, got a lot of educators, I think, that stuff. And in the nursing home, resources are very scarce. So while you bring in all these students, okay, and we have to maintain the quality in the first place. So how do you think, learning from this pandemic, the technology or the way the nursing home going to function, able to make sure that the students get the best benefit in terms of the training or education or development in here?
Okay, for me, I would say that theory based, I think the school can actually manage that. But when they are on clinical attachment with the nursing home, I would still think that they should be physically here. So yes, in fact, the training department was just started last year in April, and then we had a lot of work to do. I only have 2 clinical instructors, and then another 2 nurses who are also doing training for me lah, after their duty hours, and then of course plus myself. So it will still be limited because we still have the zoning in place. So because we need the CI support, so probably the school will have to bring in their own CI for the time being. So what we can support will be 2 CIs for the students, and then the school will support with their own CIs. for a start.
So your regulation is the CIs can actually come in because now we are all like clamping as much as possible. Nobody can come in. Like this is a forbidden place, you know.
Like what I say, it's calculated risk. In fact, I have volunteer coming in, but it's a one-to-one. It's a
Yeah,
one-to-one.
yeah.
So
It's
what
a
we did,
directive lah.
yeah, direct, yeah. So what we did was when before the volunteer, the student, yeah, it's a student volunteer. Before she came in, we actually swapped her. Yeah. So we swapped her, and then yeah, she was with us, but it's really one-to-one and limited within one zone only.
Yeah. I was just thinking, just an idea that maybe the nursing home, right? Maybe we can specialize label ourselves as specialists of certain things, you know, like we are dementia care. Then they only send in all the dementia placement, no. Or you think it's a generic, you know, everybody come year one can do general care thing and stuff, you see.
I would say that yeah, because if you say talking about like for example dementia, right? Why would they want to send it to a general nursing home? They will want to send it to a dementia home. So I would say that it is really a good experience for the students, right, to come into the nursing home, feel it, smell it, experience it. It is the best training that they will ever get. Yeah.
Okay lah.
Yes. And then when they see the number of residents, right, in the home, yeah, then they will know that actually nursing home not that easy.
Yeah,
really
of
not that
course,
easy.
of course,
Yeah.
of course. I totally can feel your sentiment.
So I'm
Okay,
very tired of my nurses. Yeah.
thank you so much, Jessica. It's very
you.
interesting to look at how the nursing homes, in terms of education. So we heard about the students, we heard about the hospitals, well, and then we heard about the nursing homes, and then now we're going to move into the Institute of Higher Learning itself. So I will invite Prof. Dora. Okay, she's going to talk on the topic on a time of innovation and resilience in teaching and learning. Now, Prof. Dora, she is my boss. No, she's
not
yeah.
true.
No, I work very closely with her as well. Okay, so Prof. Dora graduated and qualified as a registered general and district nurse from the University of Edinburgh, Scotland, in 1984. In 1984, and she did her master's at the University of Glasgow, graduating in 1992, and completed her doctorate in 2013, submitting the thesis entitled "The Exploration into What It Means to Be a Qualified Adult Nurse Working in Scotland at the Beginning of the 21st Century." Clinically, Prof. Dora has worked within varieties of clinical settings, including inpatients medical, receiving for 10 years, the UK Medical Research Council, and as a research sister for the pioneering University of Glasgow West of Scotland coronary prevention study on statin before entering nurse education in 1993. She has worked in both undergrad and postgrad nurse education in senior position. And Prof. Dora has designed and lead educational program at both pre and post nurse registration level, and well as being involved in education development, okay, including the integration of College of Nursing in Scotland into higher education sector in the early 1990s, developing a framework of interprofessional education at all 4 undergrad levels and across 13 health-related disciplines, design and implement an accelerated nursing pre-registration program at master's level for non-nursing graduates. So Prof. Dora arrived in Singapore in 2016 and take up her role as the UOG program director for the Journey Delivery SIT UOG Bachelor of Science with Honours in Nursing. The program was successfully recredited by SMB in 2020, and Prof. Dora teaches on a range of modules within the programs and lead the health ethics, teaching and learning, and assessing the honor thesis module. So, Prof, over to you.
Thank you so much. Thank you, Prof. Edward, for inviting me this afternoon. Thank you very much to SNA for also inviting me. And thank you to my fellow speakers. What wonderful inputs that we've had this afternoon. And it's a question of how do you follow that? So I will do my best. If you just give me a moment till I share my screen. Okay. Okay, can everybody see that? Yep. So the title of my talk for this afternoon is A New Norm, a time of innovation and resilience in both teaching and learning. And this is a lovely picture of the University of Glasgow and the greater Glasgow environments, which I have to say at the moment are covered in snow. It's very cold there, -4 I was told yesterday. So there you go. So before I get started, I thought it might be useful just to give you a little bit of background about the university, and I've got a couple of pictures of myself, so I'll just go through them quickly. The University of Glasgow itself was established in 1451, so it's the fourth oldest university in the English-speaking world, so it's got a very long history. It's ranked in the top 100 of the world's universities, and it's a member of a prestigious group of research-intensive UK universities. There are 24 universities involved, and they're called Russell Group universities, and the University of Glasgow is one of them. The university is regularly in the top 4 for student experience, and particularly for nursing, it is ranked the top undergraduate programme in the United Kingdom and has been for the last 5-6 years. We are a small department, but because of that, we get to know our students very, very well. It also has an international focus with students from 140 plus countries. And I've been here in Singapore since 2016, but the University of Glasgow has actually been in Singapore since 2011. So we're going to celebrate our 10th birthday this year. Woohoo! Okay, and a brief history about myself, moving left to right. As I say, the programme I did at the University of Edinburgh, I was in the last group to do what was called a triple degree or triple qualification. We graduated with our Bachelor of Science degree in the social sciences at the end of 3 years. So I graduated in 1982. And we then topped up with our general nursing certificate and our district nursing certificate. So it was called a triple. So I thoroughly enjoyed my 4.5 years. In fact, one of the reasons I put this slide in is because I feel as though I've been a nurse since I was tiny. From the age of 4, I was going to be a nurse, and that was all I was ever going to be. So I have lived nursing. I think the longest I've ever taken away from nursing has been for maternity leave. So I've gone from one job to another, all the way through from finishing school to where I am today. The picture in the middle there, I am this little person here when I graduated with my master's degree at the University of Glasgow. And here a few slightly more years later, and it just shows lifelong learning is the norm within nursing. I graduated with my doctorate, which I quite like the colour of the gown, but anyway, there you go. Okay, so I'm here. SARS-CoV-2, COVID-19 took place or emerged at the beginning of last year. And for us, for academia, it was as though almost the world had stood still. It was a time of great change within academia, but in terms of travel, in terms of being able to move around freely and independently, the world has stood still. For us at SIT UOG, we had students, Dorscorn Orange happened on the 7th, Friday the 7th of February. It's etched in my memory. We had students in practice at that point, and we had to withdraw them for practice and bring them back into school on the Monday following. So we had literally 48 hours to do a 180-degree shift. So it was a time of great challenge and great stress and of great resilience. We had to act quickly. We had to come up with aspects that would enable the students to continue their learning, to meet their learning objectives, but within a safe environment. For my colleagues in Glasgow, because we were slightly lucky, I should say, in SIT, every trimester we had 1 week of what we called e-learning, and that was a throwback from the other epidemics that we had experienced. And lo and behold, for me, I had actually conducted a Zoom lecture way back in September 2019, at that point having no notion whatsoever of what was going to come with the change. For my colleagues in Glasgow who are used to it being a traditional university, face-to-face, they had to move from that mode of delivery to online delivery, again over a weekend, literally. So we had to act quickly. We had to be really creative in what we did. For the placements that the students undertook, they had to continue their work within the school itself and communicate, I think by Skype at that particular point, because we were so early into the Zoom platforms and Teams and so on, with the clinical areas that they were working with at the time to be able to complete their projects. And through that creativity, I think we've become very innovative and really taken the opportunity to stand back and reflect and think about what we deliver and how we deliver it, and to do things a little bit differently. There have certainly been challenges. There are challenges for us as educators, and you know, my colleagues here have mentioned some of the challenges this afternoon in terms of being tech savvy, in terms of working your way around the system, not just learning the platform, but learning the nuances of the platform, being able to share your screen, for example, being able to ensure that students can hear the videos that you're playing and so on. And for students, that was challenging too, and I'll speak a little bit more about that in a moment. And of course, it took a great deal of resilience from both staff and students to adapt to this new way of learning, a way that we're not familiar with in many respects, and are now becoming quite almost blasé about on a day-to-day basis, because it's our modus operandi. So, as my colleagues have mentioned this afternoon, virtual learning became the norm. So what did this mean? For both ourselves as educators and for our students, it meant that they had to have access to technology. They had to have access to computers in the form of laptops, they had to have access to broadband, and they had to have access to the internet. Now that sounds very basic and very almost, you know, taken for granted, but not everybody has access to these things. A lot of students use their phones, their hand phones, rather than their laptops. That's okay for tiny little bits and pieces that we used to do, but with computers and, you know, online learning now becoming the norm, this was a real challenge to some students. And we have quite a diverse population of students. Not all students can afford, you know, a fancy new laptop or computer. So one of the things that we had to do at SIT UOG was to make sure that all our students did have a laptop if they needed it. So they were sent out to the students. Broadband and internet, again, not everybody has the same package. And even if you do have the same package, you could be assured that you weren't the only person in the house having to do home-based learning. So sometimes you were vying for the broadband space, and not just the space, but the privacy to be able to learn online and participate online. So these were the kind of things that you would probably take for granted, but actually become very important when you do online learning and using digital forms of learning. And then we had to choose the learning tools. Which way would we go? We decided to go with Zoom, and I know Zoom in its early days had some issues, particularly around security. We've been able to overcome these, and I think we've been able to proceed with the Zoom. And one of the nice things that the University of Glasgow could bring to SIT and to our students was that we were able to give all our students, because they're registered with both SIT and the University of Glasgow, we were able to give all students a Zoom account. Which enabled them to use that platform to have their own discussions, to be able to do their assessments and so on. So that was a nice thing that we could bring to them. But we had to learn to use Zoom. When I think back to the first time I did the Zoom, I did a 3-hour lecture and I had somebody from the Learning Technology Centre sat with me in my office just to make sure I could navigate my way around the system. And then all of a sudden, everybody's using it. We don't have enough learning technologists. So you had to really learn on your feet and think on your feet. We also had to ensure, and as my colleagues have said this afternoon, you know, online learning is very much passive in its participation. We sit and we listen, which is fine. But for students, we want to try and engage them and make them interactive. If you're looking for deeper learning, you need to try and engage your students to really get them to feel part of the learning process and of that whole experience. So that was a challenge for us. And because we are the SIT University of Glasgow, we had to ensure cross-cultural learning. Within the 3rd trimester, so SIT has 3 trimesters in its academic calendar, and within that 3rd trimester, which is April to August, the students usually undertake a 4-week overseas trip to Glasgow. And they get to go into the hospitals, they get to visit the nursing homes, they get to go out with district nurses, and we really focus on how we care for people with long-term conditions within the community, and look at the different ways of delivering care between Singapore and Scotland. And of course, because of COVID, there wasn't the opportunity to travel. We had to think of something different. How could we, because the whole overseas experience was part and parcel of the learning outcomes of a particular module. So we had to think about, well, how could we address those learning outcomes when we can't actually physically be in Scotland? So the next few slides, we're going to show you what we did. So what did we do? Well, we brought Glasgow to Singapore. Because of the COVID situation, both in Singapore and in Scotland, and because of the restriction on placement, and I should say that because we are a post-registration programme and we are a top-up degree, we've had all our clinical placements cancelled. We have not been able to do any clinical placements since really the first trimester or the latter half of 2019. So we really have had to think creatively and on our feet. So, and at the same time, students were taken out of practice in Glasgow too, which actually for them meant that they were in school at a time that they weren't expecting to be in school, and doing lessons at a time that they weren't expecting to be doing lessons. And one of that summer trimester, the students in our programme undertake 3 modules. They undertake a health and social policy module, they undertake managing long-term conditions in communities module, and they undertake principles and practice of population health module. So they undertake 3 modules and in that period. And over and above the fact that they have these 3 modules and we had our OIP cancelled, we actually condensed that whole 12-week learning block into 6 weeks to facilitate our students to go back, because our students are post-registration students, to go back into practice to be able to help with the COVID situation in Singapore. So we started later. We delayed the start of our 3rd trimester by 6 weeks to enable that to happen. So that was another challenge, and I'll talk a little bit more about that. But anyway, because of all of these things, it actually meant that by coincidence, we were able to bring our students together because they were doing a similar topic. They were learning about health and social policy. So one of the things that we did do was the module lead for that particular module found a television documentary that looked at the licensing of a drug to care for HIV patients who are HIV positive. And we brought the students from both Singapore and Glasgow to watch that video together. We split them into small groups and we enabled them to learn. They had some questions that they could had to address, and they learned and they shared their experiences with one another. We also involved staff from SIT and staff from Glasgow who were based in Glasgow for that particular experience. And it was a really, really positive experience. So positive that we've been able to present that experience at a conference just earlier this week in Ireland. Some of the feedback that we had, and I just like to read a comment from a student on that particular experience, what she said, or he or she, I don't know who. It's a really beautiful that student nurses in Singapore and UK have the same values when it comes to human rights and being ethical. It's really heartwarming when nurses come together with the same beliefs, with a wee happy smiley face at the end of it. So it was something that we could really build on and do together. And it's been a really positive experience. And it's something that we're going to look and see how we can continue with the next trimester that's coming up. We also had to look at interactive mediums. Now, Savata talked about Kahoot. We use things like Mentimeter. There are a whole range of things out there for people to be able to look at. One of the things I quite like to use, and I had used in a previous educational establishment, was Padlet. I don't know if any of you have heard Padlet. It's like post-it notes. You can have walls that have lovely backgrounds. You can choose your backgrounds, and students can put their thoughts, etc., on a wall using these wee kind of sticky post-it things. I could access it individually, but my university didn't have a license for it. So I couldn't actually use it unless I was willing to pay for it individually. My university had decided to use our Adopt Mentimeter, but the timing of their normal trimesters and the timing of when I needed to use it didn't correlate. So I had to use Mentimeter myself until the university had adopted it. So that in itself was a challenge. But using these things in regular intervals throughout a delivery on a live session and enabled the students to actually become engaged. So I would ask them a question, for example, what do the terms ethics and morals mean to you? And they would answer those types of questions. And that then gave them the ability to be that little bit interactive within the session. And we could talk about the different aspects as they came through and as they were generated through. Another thing that we did, because I was a module lead for a learning and teaching module, was I actually gave the students the opportunity to be a teacher for the day. So they were in small tutorial groups, they had topics to do, and it was over to them. They were in control of the session for the morning. And they found this really enriching and rewarding. And I have to say, every single one of them, so there was six groups, all used Kahoot. And by the end of their presentations, we were Kahooted out. And I did give them, I had a wee prize of some Scottish shortbread for the best presentation, but they really enjoyed that opportunity to be the teacher for the day and to see what it feels like to learn and to deliver a program online. So that was another thing that we did. Another thing we did was we took some of the activities that we would do in class and put them online. And within the ethics module, for example, we would have a class debate within our tutorials. And the students always enjoyed that. So we thought, well, why not do it online? We had instructions for doing it face-to-face. We had some motions. All the students were involved. So we did it within our seminar groups as an online activity. And again, it was something we weren't sure how it was going to go. So we had to really be quite resilient in our approach. And it was very well received. The students participated, they were interactive, they were passionate about, they were talking about their topics, they were passionate about the actual questions and debates that were then followed, and it was something that they really enjoyed, so much so that we're going to look and see if we can use it as part of the assessment next year coming on. The last thing we had to do was we had to think about our assessments. You talked, Savata, you talked about, you know, assessment from a student's point of view. We had to think about our assessments from an educator's point of view. And that meant moving exams online, and how did we maintain the integrity of that sort of activity. So we used a mechanism called Lockdown Browser. For our students who undertook trimester 3 within 6 weeks, we had to think about the assessments that they were going to undertake. So they would have, they had an essay, they had an exam, they had, in fact, they had 2 essays and an exam, and they each had a presentation. Within 6 weeks, to make it manageable for the students, we designed an integrated presentation that covered each of the 3 modules. So we had a case study whereby the students had to look at how they would manage somebody with a long-term condition from a Singaporean perspective, but also compare it and contrast it with a Scottish perspective. We had to look at policies that could support some of the things that they would want to do. So that would then lead them to the health and social policy aspect, and for them to look at their role in the policy making procedure. Again, using that same case study from a population health point of view, we took a step backwards and said, okay, you've got this person with this long-term condition. What would you do had you been able to interact with that person years earlier? What would you have done to prevent the onset of that long-term condition, or to minimize the potential for that long-term condition? So we were able, through the integration of these 3 topics, to have one presentation that addressed the learning outcomes as appropriate for all 3. So that was one of the things that we did. For clinical placement for my learning and teaching, we got the students to actually conduct patient education sessions in the community. They had to choose either a relative, an extended member of the family, a neighbour, or somebody that they knew well, and to do a small 15-minute teaching session. So they were able to identify the learner, they were able to identify the learner's needs, and it had to be something simple. So they came up with things like how to thicken fluids, how to do BP, how to manage your asthma through proper inhaler technique. Hand washing was a very popular topic. So those were the kind of aspects that they undertook, and I have to say it was a very rewarding experience. Also, as part of that particular assessment, we introduced a brand new form of assessment called an interactive oral assessment. So that was, we took on a scenario, we did a kind of role play. So myself and my colleagues, we were nurse managers at a polyclinic. The students were all community nurses. They had to imagine that they had been out doing their rounds in the community, and they had identified the learner that they would go on then and do the patient education session with as requiring some kind of educational intervention. So when they came back to the polyclinic, we had a 15-minute conversation about the learner, how they were going to approach their teaching session, what kind of theories were they going to use to underpin that session, and so on. So those were some of the different things that we have done. It was actually a really enjoyable activity to do. For all, it was part of an assessment, and it was a very small part of the assessment, but actually it was so successful that we will build on that next year. So the students enjoyed it, we enjoyed it. Not only was it an assessment, but we were able to scaffold the students and to ensure that they would be safe for all their qualified nurses. Some of them have not worked as registered nurses, so we had to assure ourselves that they were safe and would be practicing within a safe scope of practice when they were carrying out their teaching sessions. So it enabled us to do that kind of sense check. So it was very positive from that perspective. So we've learned a lot, and we've done a lot of positive things despite having had virtual learning being the norm. And these were all formal things. The other thing I wanted to share with you is our Nurses' Day celebration. For the first time ever, we did an online and International Nurses Day between Singapore and the University of Glasgow. Nurses Day in the UK is something that's celebrated in May. It's not celebrated to the same extent as you do in Singapore. It's lovely what you do here, or what we do here in Singapore, in terms of coming together, reciting our pledge, renewing our pledge and our commitment to our patients and the profession of nursing. They don't do that in Scotland. So this was a new experience for my colleagues. So we had a virtual cake cutting ceremony. We had students again from Glasgow, we had students from Singapore, we had our alumni with us, and we were fortunate enough to have the Chief Nursing Officer with us. We organised the event so that it started, because the other thing with this being a cross-cultural programme is that in the summertime there are 7 hours of a difference between Singapore and Glasgow, so we had to organise it to suit both parties. So we had speakers, I delivered an input, my colleagues delivered an input, the CNO delivered an input, and everybody brought along a cake, as you can see. And to round off the day, we all celebrated what nursing meant to us. So in one word, we had to celebrate it and hold our pages aloft. And we again did another Wordle to show what nursing meant to us. And that was a very successful and very much enjoyed. And as you can see with the second, where we're all holding our bits of paper up, you can see the Chief Nursing Officer there in the middle. She stayed, she participated. We were so privileged. She participated the whole 2 hours of the activity. It was great. Something that's never been done before, and it is something that I think we will look to do again with this continuation of the lockdown. Whether or not there is lockdown, I think it created a new bond and a new friendship. And again, there was opportunities within that afternoon for students to talk to one another and to learn. There was, the breakout session we had was about across border. So it was just about learning about one another rather than having a context as we did within the health and social policy module. So it was very successful. The challenges, everybody's mentioned challenges, and I will add to those challenges this afternoon. One of the biggest challenges is that it's just you and your screen. And, delivering an online lecture, you become a radio presenter in my head. You've just got you and the screen and your earphones and your microphone and so on. You don't see anybody else. So it's very, very difficult to tell what's going on around about you. And actually it puts you under a very intense spotlight as well. So, and delivering a lecture for 2 hours or so can be quite an exhausting activity, not just for the teacher, but also for the students, which is why it's so important to inject participative bits within the module or within the lecture, within the session itself. One of the other things that I did within my session was we would have a break in the middle, and I would inject a little bit of Scottishness within it. I would show them little clips from Billy Connolly, for example, who's a very famous comedian, a Glaswegian comedian. I would show them a little clip from the Edinburgh Tattoo, which is a very landmark occasion, and some other things as well, just to inject, as I say, a little bit of diversional therapy and a little bit of Scottishness. And it made up for the fact that the students couldn't get to Scotland because they were devastated, absolutely devastated, as was I. I've not been back in Glasgow since over a year ago now, but there you go, such is life. The other thing, the next, I think, most important thing is the student participation. Being online and having the equipment is one thing, but engaging the students in online learning. I think my biggest takeaway is that you have to keep your sessions short. Students get fatigued, they've got Zoom fatigued. Presenters also get Zoom fatigue. You have to break it up into small chunks. And I would say for my own learning, no more than 2 hours tops. And that also means that you have to think about what you're going to deliver within that 2 hours. If you've got material for 4 hours, you need to think about what you can deliver within that 2 hour slot and what you can then ask your students to go and do by themselves. And I think the other positive within all of this is that I think that students have become more resilient and more self-directed in their learning, which I think is a very positive thing to take them forwards. But it is a challenge, it's an ongoing challenge as to how we maintain that interaction. It's very easy for students to switch on their computer and go away and do something else, and it becomes very apparent when you split the group into breakout rooms, and there are some people that just don't join the breakout rooms because they're there in name but they're not there in body. So it is a challenge. And for me, a big challenge is not being able to see students face to face. I love to see students face to face. In learning and teaching, I draw on a lot of the students' experiences. Even within ethics, I draw on a lot of the students' experiences. And not being able to see them face to face, I can't tell whether they understand me, they follow me, they have questions, they don't have questions. Sometimes they do have questions and you've got a chat box that's full of questions, but sometimes the questions come into you privately and sometimes the questions go to the wider audience. And whilst we always try and encourage, we say that we're all in this together, we all want to learn together, we all have something to share together, students will still ask you questions privately. They are still a little bit reticent, and no more clearly does that come across than when you have a guest speaker from Glasgow or overseas. We've had some guest speakers for some of our modules, some really inspiring speakers, and because of the shyness in our students, there have been no questions, and we had this really awkward and pregnant pause where there is nothing, and you end up saying, questions, if you've got anything to say, please talk to me. And that can be awkward and disappointing for the speaker because they've given up their time. We've had a lot of busy clinicians who've given up their time. And I've known from previous experiences when the students have come to Glasgow, that there's been a lot of interaction and, good dialogue, but the barrier of the computer can be quite overwhelming, I think, for students at times, particularly when you've got somebody from overseas. And for me, I like to, when you put the students in the breakout rooms, you go into the breakout rooms as a facilitator and the room goes quiet. When I'm in a classroom, I like to wander around and to join in the discussion and to hear the buzz and to feel the buzz. And I do miss that. I am very thankful that we can still have face-to-face tutorial sessions with numbers of less than 50. And it does give me an opportunity to interact. The challenge is you have to wear a mask. And if you're like me, I need my glasses to see, to read. And when I've got my mask on and my glasses steam up because I've got my mask on. If I take my glasses off, I can't see. And it's a bit of a vicious circle. The students can't hear me because I've got a soft voice. I can't hear them because they're through their mask. I cannot wait until we don't have to use the mask again. So it is a bit challenging for me. However, such is life. And really, what does the future hold? It is the new norm. Blended learning, I think, is here to stay. The good thing is, in terms of what we're doing within that blended learning approach, is we are upskilling our students for lifelong learning. We're giving them the skills in terms of how to learn. They are learning how to learn. It's not just so much about the content, it's about how you use the technology, how you use the library, how you use materials, and so on. And one of the quotes, if I end with Albert Einstein, and it sings from my heart, I never feel that I teach my students, I attempt to give them the conditions in which they can learn. I share my experiences, I draw on their experiences, and hopefully, you know, for me, learning is a very personal thing. Everybody takes their own meaning from learning. So if I can create the conditions where that becomes possible, then I'm a happy bunny. And to end on that note, thank you so much for listening. It's been a long 2 hours for you, and I'm sure you've got plenty of things to do, but thank you so much.
Thank you, Prof. Dora.
And I'll stop sharing.
We just want to see any more questions people would like to ask. Well, that's something I'd like to ask is in terms of the what we call that the teacher and the students relationship. In terms of while you are physically with them, they tend to have a better connection. And while we are now off-site and we all go by Zoom, even though it's Zoomed, unless you know the person's pretty well or very close, a lot of times they will just quickly finish it and just press the end button and then bye and then Zoom, we go off non-stop. Well, how do you feel? Because we have been teaching for so many years, and how you think to come into reconcile of that relationship, you see, because it's always this developing of relationship, and you see them grow, and after a few years they come back, they say that, hey, hi, no, thank you so much for teaching me, you know, the life experience was so good. So I just wonder how you come to terms, because with this, now we totally don't really see them in the classroom. I mean, initially, yeah.
That is very true, and it's a difficult one to square, particularly when you've got big numbers. We have 90 within our program this year, and we will have 100 next year, and it's very difficult. And I think that's one of the reasons it's very important to be able to split the groups into smaller groups, and to be able to get to know some of the students within those smaller groups, and to use the academic advising function that we have, where I think we've got 30 students within one group, so that you get to know those students a little bit better. What I have found is, or what I have done when students ask about assessments and essays and so on, quite often I will say, rather than respond to an email, I will ask to have a quick Zoom with them, and maybe, you know, one student will ask if we'll have that, start that dialogue, and when you have the Zoom, you've got a whole wee group of students, and that gives you an opportunity to get to know them a little bit better too. One of the other surprising things, actually, and that has, I feel, enables us to learn a little bit more about them as well, is when they're doing group presentations online, live group presentations online, I actually feel closer to them and feel that you can have a much more free-flowing dialogue with the students perhaps than you would do when you're in a classroom setting, and I think it is how you use the opportunities and get to know the students. I do worry though, just going back to that, you know, Zoom fatigue and online, there are students who are very obviously interactive and ask questions, and do, you know, put their hands up or whatever, and there are others who don't, and it's very difficult to keep track of the students who are perhaps quieter in the background and who might be struggling and might struggle, be a bit more reticent to come forward to ask questions. So I do really like the fact that we can go back to some form of face-to-face, even though it's behind a mask, because I don't think there's any substitute for it, and I don't think there's any substitute for the incidental learning that takes place in a face-to-face physical sense that you don't get.
That's true. Okay, any of the panelists got anything to ask among each other, or is there anything anybody like to ask anyone of the panelists itself?
Can I just say, Jessica was talking about earlier, both of you were talking earlier about nursing homes and having students. Our first placement used to be with a care of the elderly setting, quite often in a nursing home. And that was the first clinical experience that students had, because they had more time to speak to the residents, to get to know the residents, and to engage in what I would consider is essential nursing care, not basic nursing care, but essential nursing care. So much of nursing people get hung up with the technicalities, the technical aspects, but the real backbone of nursing is the ability to communicate and to know your patients or your residents. And I think nursing homes and care of the elderly settings are ideal for that to happen. It's so important.
Yeah, that's right. Okay, I think there's a question for you, Dora.
Yeah.
Yes. Hi, Prof. Dora. Good to see you again. How do you, Shijia?
Yeah.
How do you incorporate the clinical placement setting with Glasgow and SIT students during this period? If the students wanted to see the setting in Glasgow and getting an insight of how NHS is.
Well, the short answer is we can't. But what we did do was we brought clinicians, in to talk about what they were doing. So we had somebody who was responsible for tissue viability. We had somebody who was responsible for care home facilitation. Who else did we have now? We had a range of different speakers from the clinical setting to come in and share their experiences, and also through the health and social policy module and the Nurses Day activity that we had, our event that we had, the student dialogue with one another gave them the opportunity to share that what is it like in Glasgow, what is it like in SIT. For my, the clinical placement for learning and teaching, they had to do teaching in the community. For we also have another module which you are involved with, Edward, the clinical reasoning and health assessment. Again, students would go into a clinical placement and do a physical examination and come up with a care plan for a patient. That couldn't be done, so again they had to choose somebody that they knew in the community that they could undertake a similar type of assessment and develop a care plan. I have to say, for the learning and teaching, the fact that they couldn't go into hospitals meant for me that the students actually had more control of the learning environment and outcome, because they could choose their learner rather than being having to react to the learning opportunities that were available to them, and that might not have been who they would have personally wanted to be involved with, or something that they would have personally wanted to be involved with previously, which they did get to do this time. So yep, it's always a bit of, we'll do it this time and we'll see how it goes, and there's a sharp intake of breath. But our learning from this last trimester has been that it's been very positive. We're having to be again creative this upcoming trimester with our health innovation module, so we'll see how that goes. But there is no substitute for actually being able to go and visit. And I don't know when we'll be able to go back to Glasgow at the moment. Things are really bad across the UK in general, and for Singapore, you're not allowed to enter Singapore from the UK, so
yeah,
we have to be creative.
Yeah, it's going to be worst. Yeah.
Yeah.
Okay. So thank you so much, and we have come to an end of the seminar, and I really appreciate that everybody comes in, and have to send my apologies for those that somehow lost in transaction during Zoom, can't come in. I know there's a few people wrote me an email and scolding me now and says that I have tried 45 minutes and I can't get in, and there's nobody answering me, and I was like, oh my god, I'm alone in here, kind of stuff. So, well, my sincere apology. This is the first time we are doing, and hopefully you can get more technical support to help out again in the session itself. Okay. So without further ado, I really will close today's seminar, okay, because it's already due time. For the speakers, I just have to take one group picture with you, and then yeah, we can call it a day. Sandy, do you want to show your face? You're being very quiet.
Okay. Hey.
Sandy, we need you. Your video. Hi, hello. Okay, I hope I do this right in here. You see it, press together. Okay, ready? 1, 2. No, wait, just a minute. Yeah, got something here. Okay, 1, 2, 3. Smile. Hi. Okay, done. Okay, thank you so much for all the panelists, and thank you so much for all the participants. Okay. Log in earlier. Thank you, speakers, for the information. Thank me as well. Okay, thank you. Thanks, Alan. Thank you very much. Hope to catch up here. Thank you, everybody.
Thank
See
you.
you. Bye bye.
Bye.
Bye.